An Ebola flare-up in the Eastern Democratic Congo may spread again after a patient escaped from a clinic, complicating efforts to contain the disease that has infected 6 people already since last week. The World Health Organization says the Democratic Republic of Congo was 2 days away from declaring the end of the world's second-largest Ebola epidemic when a new chain of infection was discovered on the 10th of April, following more than 7 weeks without a new case. But on Friday, a 28-year-old motorbike taxi driver who had tested positive for Ebola ran away from the center where he was being treated in the town of Beni. The WHO's Ebola response operation said it was expecting secondary cases from him. The WHO official said a 15-year-old girl also tested positive for the virus on Friday, taking the total number of confirmed new cases since the flare-up to 6. The WHO says small outbreaks are common towards the end of an epidemic, but healthcare workers need to ensure that the virus is contained by tracking, quarantining and vaccinating the contacts of new cases. Dr. Michel Yowies is the Program Manager for Emergency Response at the World Health Organization's Africa office. He joins us now on Skype from Congo, Brazzaville. For more on this, Mr. Michel Yowies, very good evening to you. Thanks for joining us. Welcome to the Globe.
Good evening.
This must be frustrating for all healthcare workers and those who are dealing to contain the spread of Ebola, isn't it?
It is very frustrating. After all this effort put to control the outbreak, and after facing all these challenges related to security, we were close to, I may say, win the battle. But unfortunately, we need to postpone, and we have also to actually boost our team to go back to work and finish the job.
So what do we know about this patient who escaped from an Ebola center? Is there any robust tracing efforts in place to ensure that he is located, and possibly to also make sure that all those that he's been in contact with are quarantined?
The work is ongoing. The authorities have been sensitized, including security, different security services, intelligence services, and we may maybe be in a position to retrieve him very soon. But in addition, an investigation is ongoing to understand more about these new cases. Fortunately, the 6 cases are linked. These are secondary cases, but we need to know where it's coming from and to ensure that the area is totally free of Ebola. We still have 1 patient in the world, but we have 4 days without any new case.
It's quite unfortunate that since hopes had been high that the World Health Organization would eventually bring the curtain down on Ebola in the DRC, what could have possibly gone wrong this time?
This can happen. If we recall the situation in Guinea, where the outbreak was declared and then we had a few cases. So for these secondary cases that we have, we try to link up with a case, and we try also to understand. Many hypotheses can be raised. For example, contamination from a survivor, or somebody, a resurgence from a case. So these are hypotheses that we are closely investigating. Now is also to ensure that the system is stronger. Mainly the national health workers, that's the system of alert work. Since we start, we are now reached the level, a good level in Beni, with about 800 alert investigate, and many of them tested. So we have resumed the work, and we are very confident that at least the situation could be under control as quick as possible.
It certainly is a double jeopardy for the DRC, isn't it? The fact that the country is already seeing a resurgence of Ebola In the era of a novel coronavirus, in terms of containment measures, are you adopting the same approaches as you've been using in the past of dealing with Ebola with regards to the coronavirus?
We were in fact in the process of reducing our staff on the ground. So part of the staff have been totally reassigned to COVID. These are two separate approach. COVID has a very fast spread within the community and require another approach. But it's the same in terms of setting up an alert system, also having the investigation team and the laboratory capacity. So at least some of the capacity built for Ebola can easily support the COVID response. So this is what we can say, and also lesson learned in this area, mainly involving deeply the community, including risk communication activities as well as community sensitization. So lesson learned from Ebola is also helping, as well as experience built from the Ebola response.
I would imagine how difficult it can be implementing what you've just articulated with a country of about 80 million plus people, conflict in the east and crowded shanty towns. It must be really an uphill battle, encouraging people to practice what is now known as social distancing.
It is a challenge in many countries, but we need to readjust interventions based on the context in Africa. Many of these communities even don't have access to water, so any confinement measures should be implemented, adding critical interventions like water supply or distribution of what we call non-food items like soap, as well as making sure that the vulnerable people have also access to food, because these are all the things that can help. And any confinement measure should also go along with a strong case detection, confirmation, as well as isolation. It's a challenge, but I think all the partners are now mobilized around the national authorities to do so. It may be a long outbreak, so we need to ensure that we have also a continuity of some of the services, and also we deal with the ongoing outbreak, including the measles. That was one of the major outbreaks the country experienced in the last 10 years. So while dealing with COVID is to ensure that also we have some continuity of service to avoid death related to other health conditions.
So with regards to reaching those inaccessible communities, considering the topographical nature of the DRC and, of course, the conflict in the eastern part of the country, so how does the WHO navigate its way around getting to those areas?
In the Ebola situation, we were relying on the national security as well as also the UN security. In the case of COVID, it could be maybe a good, a positive factor of having remote places, so it can delay also the spread of the disease, as it's not the case in the big cities where people are more crowded. So in this situation is what we were doing in Ebola. You have to negotiate any single access, or you have to use also some of the escort, and you have also to sensitize the communities and have them on board, because most of the militias are embedded within this community. So having communities on board can help. And these are also part of what we learn while dealing with Ebola in a very challenging environment.
And I understand that the DRC has been leveraging the capacity they built up to test for Ebola to now test for coronavirus. So are the community members receptive to these testing mechanisms? And, in terms of capacity of the WHO and the teams on the ground, is there enough capacity to conduct those tests, given the magnitude of the population of the DRC?
The capacity could not be enough, and it's the same challenge that many African countries are facing. They are using for Ebola a technology called GeneSped that is quite well decentralized because the same technology is used for tuberculosis. Very soon the cartridge to use this equipment will be available, and it will help to increase the testing capacity, but it will be very difficult, challenging to test as many as they wish to test. But in the African settings, we have also to rely on symptoms, and it won't be possible to do the same. There are also maybe coming possibilities, rapid diagnostic tests. We hope that some of them will reach a level that WHO will recommend, and we are actually advising the country to test them so that we can see the specificity and sensitivity. These are a characteristic of rapid diagnostic tests that can be experimental, so that decision can be made for the use, and also limitation of the use can also be known. So these are things that we are supporting in to ensure that at least the minimum capacity is there for detection.
So how many tests are conducted per day, and are you at all happy or impressed with that rate? From the last information that we have, they are having about 300. Maybe this was last week. Maybe this week they have scaled up. It's still not enough, but the main thing is that the time being we have the outbreak located in some of the area. If we recall about the decision to have a confinement, it was decided based on the epidemiological analysis that point out one of the areas that was the most affected in the capital city. All right, Dr. Michel Yowies, the Program Manager for Emergency Response at the World Health Organization's Africa title, joining us via Skype. Thank you so much for your time. We appreciate it.
It was a pleasure. Thank you very much.